And the next disease caused by bacteria, and the bacterial disease of the respiratory system, and the next one is the pneumonia. And in the case of pneumonia, so an inflammatory processes in lung parenchyma usually associated with a marked increase in interstitial and alveolar fluid. And the pneumonia is an infection disease of the lower respiratory tract in the bronchial tubes of the lungs. And a wide range of microorganisms including virus and bacteria cause pneumonia. The term pneumonia is used to describe any inflammatory condition of the lung in which some or all of the alveoli are filled with fluid and blood cells. And the picture showing the normal alveoli, and this is the pneumonia affected alveoli. Pneumonia may be pneumococcal pneumonia when caused by Streptococcus pneumoniae, and the primary typical pneumonia when caused by Mycoplasmum pneumoniae, and the chlamydial pneumonia when caused by Chlamydia pneumonia, and the Klebsiella pneumonia when caused by Klebsiella pneumoniae, and serraceal pneumonia when caused by Serratia marcis. Of these, all are gram-negative rod with the exception of Mycoplasma and Chlamydia, which are pleomorphic and devoid of cell walls. The majority of bacterial pneumonia is caused by Streptococcus pneumoniae. More than 90 strains of this bacteria have been discovered. Emergence of resistant strains is causing concern to medical scientists. So, there are different types of these pneumonia causing bacteria are identified, and some are discussed. Some are the Streptococcus pneumoniae, Klebsiella pneumoniae, and the Chlamydia pneumoniae, Serratia marcis. These are the some strains of bacteria causing pneumonia, different types of pneumonia. And then conditions, mode of infection is the in pneumonia, infection is acquired when a person inhales or comes into contact with the aerosolic droplet from infected people. ഒരു ഇൻഫെക്റ്റഡ് പീപ്പിൾസിൽ നിന്ന് എയർ വഴി ഡ്രോപ്ലെറ്റ് ഒരു ഹെൽത്തി പേഴ്സണെ ഇൻഫെക്റ്റ് ചെയ്ത് കഴിഞ്ഞാൽ, and the patient is malnourished people, smokers, people with viral infections such as AIDS, those on immunosuppressive drug are at high risk of acquiring the disease. And the Klebsiella pneumonia is generally acquired from hospitals. Infections that are acquired from hospitals are called nosocomial infection. അപ്പോൾ ഇങ്ങനെ ഒരു ഹെൽത്തി പേഴ്സൺ അല്ലെങ്കിൽ വേറെ ഏതെങ്കിലും ഇങ്ങനെ അസുഖത്തിന് ട്രീറ്റ് ചെയ്തുകൊണ്ടിരിക്കുന്ന ഒരു എയ്ഡ്സ് പോലുള്ള ഉള്ളൊരു വ്യക്തി, അല്ലെങ്കിൽ ഒരു മാൽ നറിഷ്ഡ് ആയിട്ടുള്ളൊരു പീപ്പിൾ, അല്ലെങ്കിൽ ഒരു സ്മോക്കർ, ഇങ്ങനെ മറ്റുള്ള വൈറൽ ഇൻഫെക്ഷൻ ഉള്ളവർ, ഒരു ഇമ്മ്യൂണോസപ്രസീവ് ഡ്രഗുകൾ എടുക്കുന്നവരൊക്കെ ആണെങ്കിൽ അവർക്ക് ഇത് വരാനുള്ള ചാൻസ് കൂടുതലാണ്. അതേപോലെ തന്നെ ക്ലെബ്സീലിയ ന്യൂമോണിയ എന്ന് പറയുന്നത് സാധാരണ ഹോസ്പിറ്റൽസിൽ നിന്നാണ് ഇത് ഒറിജിനേറ്റ് ചെയ്ത് ഒരാളിൽ നിന്ന് അടുത്തൊരാൾക്ക് പെട്ടെന്ന് പകരുന്നത്. ഇൻഫെക്ഷൻസ് ദാറ്റ് ആർ അക്വയർഡ് ഫ്രം ഹോസ്പിറ്റലിൽ നിന്ന് ഇങ്ങനെ പകരുന്ന ഇൻഫെക്ഷൻസിനെ നമ്മൾ വിളിക്കുന്നത് നോസോകോമിയൽ ഇൻഫെക്ഷൻ എന്നാണ്. ആൻഡ് പിക്ചർ ഷോയിങ് the normal, and in the normal lung the air spaces are seen, but in the case of alveoli with pneumonia, inflammation of alveolar wall, fluid and pus filled air space contain bacteria and blood cells, and this is the conditions of pneumonia. And the fluid in air sacs, it will reduce the amount of oxygen inside the alveoli, so it will increase the carbon dioxide concentration inside the alveolar tube. So this condition is known as the hypoxia or hypercapnia. This leads to organ failure and death. And also these patients have a respiratory distress, breathlessness, and alveolar tissue fails to perform its normal function, that is the exchange of gases. So because of the increased or the infection causing hypoxia and hypercapnia due to the increasing level of carbon dioxide, so this will create leads to organ failure and death. And the diagnosis is by symptomatic correlation with isolation and culture of the bacteria involved. Mortality rate is higher in elderly and weak people, and the treatment including is the administration of antibiotics such as penicillin, tetracycline, and chloramphenicol. Because this is a gram negative bacteria, and these antibiotics, penicillin, tetracycline and chloramphenicol can destroy the infection caused by this bacteria. And these bacteria also and the chloramphenicol are affected the bacterial ribosome and easily destruct the pneumonia bacteria, and these are the treatment system, and the people allergic to these drugs are given erythromycin. So erythromycin and the tetracycline chloramphenicol are easily destroy the pneumonia causing bacteria.